Hello, my viewers. How are you? Hope all is well. It's me again, your friend, your sister, your auntie, your well wisher, your little girl, Aunty Abidoc. I'm here again to bring you yet another type of disease, to explain to you what we can do to prevent them, to tell you about the risk factors, and to tell you how we can treat them. On this platform, we explain this, and this one we're gonna be doing it, this particular one, on cerebrovascular disease. Cerebrovascular disease. Okay, what are cerebrovascular disease? What are they? Cerebrovascular disease are conditions caused by problems that affects the blood supply to the brain. There are many types of cerebral vascular disease. So, what are the different types? I will tell us now. The different types of cerebral vascular disease are: 1. Stroke. What is stroke? Stroke is a serious medical condition where one part of the brain is damaged by a lack of blood supply or bleeding into the brain from the burst blood vessel. 2. Transient ischemic attack, TIA. Transient ischemic attack, TIA, is a temporary fall in blood supply to one part of the brain, resulting in brief symptoms similar to stroke. The third one is subarachnoid hemorrhage. I'll say that again. Subarachnoid hemorrhage. Subarachnoid hemorrhage is a type of stroke where blood leaks out of the brain blood vessel onto the surface of the brain. Vascular dementia, it's another one. Vascular dementia is a persistent impairment in mental ability resulting from stroke or other problem with blood circulation to the brain. We will now discuss all the above in more details. So we will start with stroke, and for the benefit of this particular video, we're gonna stay on stroke. So other videos will then treat other types of cerebrovascular disease. So for the benefit of this particular video, we're gonna go in depth on stroke. So, to function properly, the brain needs oxygen and nutrients that are provided by the blood. However, if the blood supply is restricted or stopped, brain cell dies. And once this happens, it leads the brain to damage and possibly death. So if this supply is restricted, the brain cell dies, leading to brain damage and possibly death. I hope we understand this. A stroke happens when blood supply to part of the brain is blocked or interrupted. Which question? Okay. So, can blood flow to brain be blocked? Yes. It can be blocked. The answer is yes. And your next question is, how? You mean how could it be blocked? Is that what you're asking? Yeah. I will use an example. For example, it could be blocked by a blood clot, where the blood thickens and solidifies. And this is the common cause of stroke and is known as ischemic stroke. The lack of blood causes part of the brain to die. This process is known as cerebral infarction. About 10% of stroke are caused by bleeding from arteries in the brain. And when this happens, it directly damages brain tissue and can also cause loss of blood supply. This is known as hemorrhagic stroke or cerebral hemorrhage. What question? Are there symptoms for stroke? Yes. The answer is yes. There are symptoms for stroke. And the main symptoms of a stroke are better remembered using the word FAST, F-A-S-T, which describe face, arms, speech, time, test. Pardon? Could I explain fast? Yes, I am going there. I will explain it. F means face. The person's face may have fallen on one side. They may be unable to smile, or the mouth or eye may have dropped. A stands for arms. They may be unable to raise one or both arms and unable to keep them up as a result of weakness. S stands for speech. They may have speech problems and difficulty finding words or understanding what is said to them. And the last word in fast is T. That means time. That means it is time to dial 999 immediately if you are in the United Kingdom, or call the emergency number in whichever country you are, so that the person can get to the hospital as soon as possible. So if you see any of these signs that we have mentioned, please do not waste time. Save life by getting them help immediately. To be precise, I mean doctor's help. They need to get straight to the hospital. Yes. What's the next question? Okay. Apart from the FAST system, am I getting your question right? Apart from the FAST system, are there any other symptoms? Is that what you're asking? Okay. Yes. There are, and this includes 1, confusion. The person will be highly confused. 2. Unsteadiness or inability to walk. 3. Loss of vision in one eye or on one side of the field vision. A stroke is a medical emergency. The sooner treatment is given in hospital, the less damage is likely to occur. So, minutes count. Do not delay. Get help immediately. Help the person immediately. Get them to the hospital so that we can save their life. Please. And the next question is, does stroke affect children? Is that your question? Yeah. The answer is yes. Stroke does affect children. Cerebrovascular disease are less common in children. However, stroke can sometimes affect children. So, how can we prevent it then? The best way to prevent a stroke is to eat a healthy diet. 2. To exercise regularly. 3. To avoid smoking. 4. Avoid too much alcohol. Avoid too much alcohol. These lifestyle changes can reduce the risk of the problems such as atherosclerosis, high blood pressure, high cholesterol level, all which are important risk factors for stroke. Another question is it possible to have stroke more than once? The answer is yes, it is possible. But making the above lifestyle changes can help reduce your risk of having another one in future. Diet. An unhealthy diet can increase the chance of having stroke because it may lead to an increase in your blood pressure and cholesterol level. Therefore, a low-fat, high-fiber diet is usually recommended, including plenty of fresh fruits and vegetables, at least 5 portions of fruit and vegetable a day. 2. Ensuring a balance in your diet is important. Do not eat too much of any single type of food, particularly food that are high in salt or processed food. You should limit the amount of salt you eat because too much salt increases your blood pressure. Exercise is very important. Please watch Aunty Abidoc's video on atherosclerosis and find out about different type of exercise that you can do. It's all there on YouTube. Stop smoking. Cut down on alcohol. This has now brought us to the end of this discussion about stroke. Thank you so much for watching. This is my live talk show on different type of diseases, how we can prevent them, how we can treat them, and what we can do to not have them. So thank you for watching. I love you. I say stay blessed until I see you again. It's one love. Share. Thank you. God bless. Love you. Bye. Bye-bye.